Walking into a clinic is often, well, it's kind of like stepping into a foreign country. Like,
Yeah.
everyone looks like you, but suddenly they speak a completely different language.
Wow, absolutely. It's an incredibly disorienting experience.
Right. You're just sitting there in that crinkly paper gown, nodding along to words that sound less like science and, I don't know, more like ancient Latin spells.
Yeah, and we naturally fear what we don't understand. And when it comes to your health, that lack of clarity, it just completely spikes your cortisol.
Exactly. So today we're taking a deep dive into decoding the pronunciation of tricky medical vocabulary in English. We've been combing through linguistics notes, medical glossaries, all this healthcare communication research to really crack this code.
Yeah, because whether you're prepping for a doctor's visit or maybe studying healthcare or, just trying to figure out what's happening on your favorite medical drama, getting these words right is absolutely crucial for you.
So to make this really stick, we're treating this deep dive as, like, a guided tour. So if you're looking at the visual guide we've prepared for you, picture these words appearing on your screen in 3 distinct groups for the next few minutes.
Right, and I am going to break down the pronunciation slowly, highlighting the stressed syllables, and we'll anchor each one with a memorable scenario to really lock it in.
Okay, let's unpack this.
Yeah.
So picture the first group of words flashing on your imageries now. These are the everyday touch points like the medicine cabinet and, routine blood work.
Your classics.
Yeah, because let's face it, trying to read a lab report is like trying to decipher a scrambled code.
Mhm.
You see a word that looks like creatinine and you instantly assume, well, you're failing a test.
Ah, yes, the dreaded lab report panic. Let's tackle the medicine cabinet staples first, starting with the classic painkiller. It is ibuprofen. You really want to put heavy stress on the PRO.
Got it.
So, for example, after staring at a blinding computer screen for 10 hours, I desperately needed some ibuprofen to quiet my screaming headache.
Oh man, an absolute lifesaver. And what about the other major painkiller?
Right, that one is paracetamol. The emphasis lands firmly on the C. So you'd say, the pharmacist practically had to decode my delirious mumbling before handing over the paracetamol for my fever.
That is way better than just like pointing at the shelf and grunting.
Yeah.
So what about those scary lab report codes?
Let's decode 2 major ones. First, the protein that carries oxygen in your blood. That is hemoglobin. You stress the he.
Hemoglobin. Okay.
Exactly. Like the marathon runner collapsed at the finish line because her hemoglobin levels had completely tanked.
Oh, wow. And then there's the kidney function marker I brought up earlier. How do we actually say that one?
That is creatinine. The stress hits really hard on the AT, so the specialist ordered a creatinine test just to make sure his kidneys were actually filtering out the junk.
Okay, creatinine. So once you navigate the pharmacy and decipher those labs, you're usually sitting in the exam room. Let's visualize our second set of words on the screen right now, the action words and descriptors.
Right, the clinical terms.
But, like, here's where I want to push back a little bit. Do doctors use words like susceptible or benign just to, I don't know, sound more official? Honestly, why not just say at risk or safe?
It's a really fair question, but it actually isn't about ego at all. It's about absolute clinical precision. Like, words like safe are subjective, they change depending on who you ask.
Okay, that makes sense.
Right, whereas clinical terms carry universally understood biological criteria. So let's look at the verbs. First is examine. Notice the sharp Z sound. The dermatologist needed a high-powered microscope to examine in the bizarre rash.
Gotcha. And the next one?
Next is determine, not mine at the end, but min. Like, we need a full MRI to determine exactly why your knee keeps buckling.
Okay, yeah. Precision definitely removes the guesswork. But what about those terrifying adjectives?
The contrast here is so vital. A non-cancerous growth is benign. It has this soft, almost floating sound. Waiting for the biopsy results was terrifying, but thankfully the cyst was completely benign.
Oh, that's such a relief. And the opposite?
The opposite, meaning cancerous, is malignant. The heavy emphasis hits right in the middle, almost like the word itself is aggressive. The surgical team moved quickly once they realized the tumor was malignant.
That is a massive difference. And the term for being at risk, I always kind of think of it like a lock waiting for the wrong key, like a specific biological vulnerability.
Ah, that is a great analogy. That word is susceptible. So chronic lack of sleep makes you highly susceptible to catching whatever awful cold is going around the office.
Yeah, tell me about it. Finally, let's visualize our third and final word group navigating the hospital maze.
Oh boy.
Yeah, because if your condition requires specialized care, you actually have to figure out which department to walk into without, totally twisting your tongue.
These are the ultimate tongue twisters, honestly. Let's start with the ear, nose, and throat department. It is O-Tolerin GAH Luigi. The big stress is on the GAH.
Wait, oh, Tolerin GA Logi.
You got it. After 6 months of a nose that wouldn't quit running and mysterious earaches, she bypassed the general clinic and went straight to Otolerin GAH Logi.
Wow.
Hmm.
Just saying, that feels like a medical procedure burning calories.
Yeah,
That's the last one.
it definitely takes practice. And finally, the numbing medicine experts. That's an anesthesiology.
Oh, wow.
Yeah. The absolute heroes in anesthesiology ensured he was dreaming peacefully before the scalpel even moved.
So what does this all actually mean for you, the listener? Mastering these pronunciations, it's not just some party trick to sound smart. It's about clear, confident communication when the stakes are, frankly, really high.
Exactly. When you understand the vocabulary, you kind of reclaim a bit of control over your own healthcare journey. It completely bridges the gap between patient and provider.
Which brings us right back to that crinkly paper gown. And it leaves you with a really fascinating question to just mull over, like how much of the pure intimidation factor of going to a hospital simply comes down to a language barrier?
That's a great point.
Yeah, and if you walked in there confidently pronouncing otolaryngology, could mastering these words actually be the secret to lowering your heart rate in the waiting room?